This is an ultrasound study of a 35-year-old female with a history of ascites, protuberant abdomen, is HCV positive. What is seen is that the kidney is normal, both folds are clear, otherwise unremarkable. The liver shows fatty liver parenchymal changes, and the intrahepatic vessel margins are not that blurred to label it as a cirrhotic liver. However, I will label it as a fatty liver. Now, this is the right hemidiaphragm. This is the right hemidiaphragm, and there is fluid in the pleural space, right pleural space. This is the fluid in the right pleural space, and from the subcostal region, you will see it in a better view. This is fluid in the right pleural space. This is the liver, and this is the transverse section of the kidney and liver surrounded by ascitic fluid. Okay, now in this, please do consider one thing while you are performing this scan, that you will be if you see fluid in the both pleural space as well as in this abdomen or surrounding the outer surface of the liver as well, then be sure that this is not the ascitic fluid. This is the pleural effusion, and this is the ascitic fluid. Fatty liver, parenchymal changes are seen. Gallbladder is normal. No binding portal vein is of normal caliber with no and is patent. Now this is the left lobe of the liver in transverse section. No evidence of intrahepatic bile duct ectasia, and this is the left ascending part of the left portal vein in view, which branches entering into it. This is the left horizontal branch anterior, and this is the ascending part of the left portal vein. This is the left horizontal branch. Right horizontal branch entering the portal vein. Now, there is an issue over here, and the issue is that there is a hypoechoic area seen. This is within this liver, measuring approximately 3.6 by 2.9 centimeters. And it is solid, reason being you can see the posterior wall, no acoustic enhancement or strong back wall is seen. This is, it appears from this angle to be relating to the segment 3 of the liver. Okay, now let's have a longitudinal section of the left lobe. Now you see that, let's see where is the caudate lobe. Do we see caudate lobe? Now this is in fact, the location of the caudate lobe, and this is the longitudinal section of the left lobe of the liver. This is the caudate lobe, and this is the IVC. You know, caudate lobe is bounded anteriorly by the ligamentum venosum. This is the ligamentum venosum. And this is, the IVC course is posterior to the caudate lobe. So this is the caudate lobe, and the caudate lobe is showing mass measuring approximately 5.0 into 2.1. This is also called, caudate lobe is also called segment 1 of the liver, and this area is representative of another solid focal lesion relating to the segment 3 of the liver. This is the liver, and this is the focal lesion. It is not cystic, it's solid and hypoechoic, this area. Now let's concentrate a bit on other areas. This is the aorta in longitudinal section. This is the spherimesenteric artery. Arising from it, we do not see any adenopathy, and this is the region of the porta hepatis. This one, no adenopathy over here. This is the IVC. Sorry. This is the portal vein. This is the portal vein, and here I'll show you the. Let's see the pancreas. This is the superior mesenteric artery transverse section. This is the aorta. This is the pancreas, the tail of the pancreas. I'm going to magnify to show you that this focal lesion, a part of it being echogenic and a part being hypoechoic, relates to the caudate lobe of the liver, because otherwise the caudate lobe is not seen separately. And this is the location for the identification of the caudate lobe. What's important to see in this is that this is not a purely hypoechoic mass. It's in fact, it contains an echogenic area as well. This is an echogenic part in it. Meyers, this is the true measurement now. So mixed echo, in a sense that most of this mass relating to the caudate lobe or segment 1 of the liver is hypoechoic, with echogenic area protruding into it from its posterior wall. It's bounded anteriorly by ligamentum venosum, and posteriorly we can see IVC coursing through it. And this is fluid, ascitic fluid. This is the IVC, this proximal IVC coursing posterior to the caudate lobe, and this is the mass relating to the segment 1 of caudate lobe of the liver. Now, had I seen the caudate lobe separately, I would have said that, well, this can well be a lymph node, but it is not, because if this is a lymph node, then where is the caudate lobe? You will not see it. So an echogenic area protruding into this hypoechoic lesion relating to the caudate lobe in longitudinal as well as in transverse section is, you see, typical location of the caudate lobe. So this is a caudate lobe mass, hypoechoic as well as echogenic. Here you will see another thing, that this is the spleen, this is the spleen, this is the left hemidiaphragm, and the spleen measures, this is the spleen, this area is spleen. Spleen measures 4.6 and is small sized. Okay, let's make it 4.98 and 5.1. Up to 5 is the lowermost normal limit, except the limit of the spleen. So anyways, the spleen measures 5.1 centimeter, and this tissue, this area, echogenic area, is in fact the liver, and liver is seen hugging the spleen. This white band of tissue is the liver, and liver is hugging the spleen. This spleen, liver, and rest all of these are bowels, and this is the ascitic fluid. This is the fluid. Now see that this is the pelvic region of the patient, and we see that this is the urinary bladder. There are floating echoes. You can see that this is the floating echoes within this ascitic fluid. These are the bowels floating in it. You know, this is ascitic fluid filled with echoes. Now another. So this is our case of the day, patient with cirrhosis, not cirrhosis, with fatty liver, focal mass relating to the caudate lobe of the liver, or the segment 1 of the liver. So this is important, that echoes are seen usually in aggressive pathologies. This is our case of the day. Thank you very much.